Hello, everybody. I'm Vahedi, and this is my presentation on semaglutide, its effectiveness, its side effects, and its cost. So, looking into the background that I have, as I mentioned, my name is Manny. I live in Cumberland, Maryland. That's on the west side of Maryland, 2 hours away from Baltimore, for those who know. So, nobody really knows my town. It's a small town, but it's very beautiful. There's a picture right there. My mentor was Bijal Luhar. She was fantastic. She was great, very flexible, very helping, very supportive. Shout out to Bijal. And why did I choose semaglutide? Because the United States is having a obesity epidemic, as it's called, which just basically means obesity is becoming a rising concern, and that's going to affect the lifestyle of many people negatively. So, overview of the presentation. First, we'll look at what is semaglutide, get into, what really is before we dive into information about it. Then we'll look at its effectiveness and side effects. Then we'll look at semaglutide as GLP-1 receptor agonist, and we'll go on to say what that really means. And then we'll look at a cost analysis of semaglutide. So the aim of our presentation or pitch today is to have a comprehensive analysis of semaglutide, including its effectiveness, side effects, its role as a GLP-1 receptor agonist for managing diabetes and weight loss, and the long-term challenges associated with its use. However, we'll be looking more at the weight loss aspect of it today as it tackles on obesity. But before we get into anything too specific, I want to mention a specific statistic. That is that by 2030, 1 out of 2 people in the United States will have obesity. That's less than 5 years from now, guys. That's insane. That means 1 out of every 2 people you can meet could be obese, and of course that comes with its complications, with many risks, increased heart disease risk, and very difficult lifestyle issues. So now getting into our presentation, what is semaglutide, first of all? So semaglutide is a medication for obesity and type 2 diabetes. We'll be focusing more on obesity here today, although it has that additional benefit for diabetes. It's a receptor mimicker specifically for GLP-1, which is why it's able to be so effective. And that'll be more specific. We'll dive into that later on. And it's all known under the common brand name of Ozempic, or which many people probably know. You might know Ozempic, you might have heard of it, but it's also known as Wegovy or Rybelsus. And it can be administered through two main ways. That's through injection, which is common for Ozempic and Wegovy, or tablet, which is more typical with Rybelsus. So looking at the effectiveness of semaglutide first, um, semaglutide was more than double, as effective as others when it came to weight loss. As we can see through two mainly and widely claimed trials, the STEP and SUSTAIN trials for semaglutide, it was able to result in a 15% weight loss reduction compared to others such as liraglutide or orlistat, which only had 6.5% reduction. And that goes to show how much of a better alternative it is and how much of a revolutionary tool and treatment it is for obesity. Now, in terms of its side effects, it does come with a few, unfortunately. However, there are solutions to these. So firstly, we have GI effects or gastrointestinal effects. Those are nausea, diarrhea, or constipation. And the most common of all is nausea. And specifically, 35% of users experience nausea through the early weeks of treatment. And then we also have more long-term and serious side effects, such as pancreatitis, pancreatitis, gallbladder disease, and kidney problems. However, these subside over long-term use along with the GI effects, and these can actually go away and be prevented in the first place through some common alleviation methods as well, such as having small portions whenever you consume foods, in early weeks of treatments, consuming low-fat foods, having a low-fat diet, and getting fresh air every once in a while. That can help with feeling better, and that can help really with the nausea as well, which is the common side effect. Now, going to semaglutide as GLP-1 receptor agonist, that whole big scientific aspect is, it's really simple. So basically, semaglutide, first food is consumed, right? Then GLP-1 is released in your body, and that's a receptor that just attaches to your cell, and that calls for, gastric emptying, which is basically where your body releases food's contents into your small intestines. However, GLP-1 is reducing that. So it's causing food to stay in your stomach longer, making you feel fuller. That's why when semaglutide mimics this, it's able to make you feel longer for fuller, not eat as much food, and that's why it's beneficial. It also induces insulin and inhibits glucagon, which is essential for diabetes, and it prevents post-meal blood sugar spikes. And then obviously weight loss from the reduced gastric emptying and that sensation. Now, moving into cost analysis of semaglutide, it is not on the cheaper side, unfortunately. However, that can be alleviated and fixed in the long term. So, for those that are insured, about 70% of insurance companies cover semaglutide treatment, and that percentage will increase as it becomes more common and more tested upon. However, for those uninsured, you can be looking from anywhere between 850 to over $1,000 a month, unfortunately. However, again, those can decrease over time as insurance companies become more accepting of it. And there's also competitors such as tirzepatide, which actually has shown also similar levels of weight loss compared to semaglutide, which is a huge competition for semaglutide. So that's going to cause lower costs for competition and more experiments to make sure really semaglutide's on top of its game compared to others. So that leads to eventual affordability and lower costs. Now, in terms of our conclusion here today, semaglutide can offer significant efficacy. It's more than double as effective as other treatments, with the exception of tirzepatide. However, that doesn't stop it from still being one of the top treatments we have for obesity currently. There are economic barriers, of course, such as the high cost per month for those uninsured. However, with competition and with more time passes on, it's more accepted. That's going to reduce over time, and that's going to help those who are, on the uninsured side. And as for additional benefits, not only will it help contribute to weight loss and preventing obesity, but a step further from that, what happens when you don't have obesity no more or you have reduced weight loss? Not only you're going to feel better, more confident in yourself, especially if you were considering semaglutide as treatment, but you're going to significantly reduce your risk of heart disease, cancer, or any other really serious conditions that can come with obesity. So thank you for listening to my presentation on semaglutide. I hope you guys enjoyed, and now a little more about how much of a concern obesity is and this one step out of many that is being taken to prevent it. Thank you.